the details of the program. As a current student, Dr. Amitava Mukhopadhyay is with us today from Australia. So we're delighted to have him here, and he is a current student on the program. So we just invited him onto this webinar to give his own experiences on the program and let him know how he's getting on. Amitava, I suppose the first question is, why did you pick the program?
Yeah, first, hi to everyone. I work in emergency medicine, but I picked this program and I recommend everyone to join this program, the first, just because it's just a family. It's very, very informative. And the dashboard and teaching from the teachers are so informative and evidence-based, structured, and whole training, I think, is so good. And especially online, if it's possible, like this kind of training, I did not have any idea. I just joined it because I've gone through certain feedback and certain review of this program, and then I've decided to join. And I have few friends in Ireland, and they basically heard from someone I don't know, but they work with me here. And they've told that, if Royal College of Physicians, any program, just join it. It's very good. When you work in emergency medicine, if 20% presentations are pediatric. What happens in the ED, just because, 4 hours time and breaching period and things like that, our assessment of pediatric patients are not good enough, what I believe. Even if you go through emergency training, it's a kind of protocol based. But the training, when pediatricians, they come to review a child, and I can see that, now I understand much better certain things. And I think I'm very happy that I've joined this program. Like, for a long time, there are some issues to understand the centile chart and how to, put weight growth and, head circumference, and how to deal with those kind of issues. So I would say, just, long story short, that I recommend everyone, and I have joined just because, I thought online training in this kind of scenario at this stage, present situation in the world, the best way to go as well. I'm very happy with it.
Wonderful, wonderful. And I suppose, is this your first online education experience, Amitava?
Yeah, this is my first online educations. But I also am talking to, Queen Elizabeth Hospital in London to do certain other trainings.
Okay.
But this is my first online training, yeah.
Wonderful. And just a few more questions. In terms of time commitment and balancing, I am sure, your very heavy clinical workload, your family commitments, all of that, how are you finding that, and then be able to dedicate a sufficient time to the program?
I think overall the program administrators and the teachers, they are very, very cooperative. In case you are unable to attend the teaching, all the video lectures, everything on the dashboard, so you can go back and go through that. And another thing is that, it's just 1 hour in a day, and if you can't attend, you always can ask teacher to get another. Just like with Charlie, I've done a couple of lectures, just, I've just requested him, and I have done individually, one-to-one. Yeah, one-to-one, and that was very good. It's definitely, even the workload you have, I think that 1 hour in a week, it's okay, I think.
It should manage. It's manageable. Yeah. Good.
Yeah.
And the exams, Amitava, how did you find that experience?
I think because I'm not from pediatrics, from emergency medicine, so there are certain informations I had to read multiple times. And because, it's busy period, my preparation probably was not good enough. But exams are pretty good, I think, well structured. But yeah. I could have done better, I think. I could have done better if I would have more time to read. But there are a lot of informations in dashboard, and teachers, they explain everything very well. So I think enough resources, enough information, very clear. So it should not be an issue at all, I think. It's a very good program. I really appreciate that program.
Wonderful. And I suppose one of the last questions I would ask is about the kind of online experience. How did you find that, the actual online environment and working with that?
It's very comfortable. It's very, very, accessible. I think you should have, functioning either laptop or functioning iPad, and it is good enough. You can basically attend any lectures and very easy to follow.
Super, super. Thank you so much. Now, Amitava, I'm sure you're very, very busy and you may not be able to stay on with us. We'd love you to stay on, but if you have to go on and you have a busy schedule, that's no problem. But if you want to stay on for the duration of the session, you're very welcome as well. But you're under no pressure either way. Yeah. So, but thank you so much for your input. I think it's very valuable for other people who are interested, other doctors who are interested in participating, that they hear the experiences of a fellow clinician.
Yeah, definitely. I recommend every country participant, everyone. And because, I worked in India and then in England, now in Australia. So I have traveled and I worked in different systems. And I believe this program is unique. And especially online platform to provide this kind of program is really, really very good.
Super. Thank you so much, Amitabh. I really appreciate your time.
Okay, Rebecca, I need to go. I have got on call.
No problem. Thank you so much. Just to let you know, everyone, that Amitabh is reflective of the wonderful composition of nationalities we have from all over the world on this program. We've doctors from Australia, like Amitava, and from Malaysia, and from all over the Middle East, Africa, Europe, and the United Kingdom, Ireland. So it really is a huge global mix of doctors working, not just general practitioners, even though a good percentage of the doctors are general practitioners and family physicians on this program, but we also have pediatricians upskilling and just refreshing their knowledge, and we have specialists in tertiary care. So we have a huge mix, and it's wonderful to have that mix of nationality and clinical backgrounds. So I think it adds to the flavour and the colour of the program. So I'll just commence with the overview of the program for you now. So when you hear about the Royal College of Physicians of Ireland, the Diploma in Paediatrics online, you will interchangeably hear the word iheed a lot. And you might ask, who are iheed and what do they have to do with the RCPI? I work for the iheed, and all of our tutors do. And we are what would be called an OPM, or an online program manager for global medical brands, postgraduate training education internationally. So we represent the elite of medical education in an online environment. We're an Irish company. We're headquartered in Dublin. And we, even though, as Diarmuid said, we haven't seen our office in a very long time. We're all working from home, unfortunately, but we are headquartered in Dublin. We have large contracts with ministries of health globally and governments, and we are specialist healthcare educators. We do not educate in any other vertical or any other subject area whatsoever. We were formed by doctors and clinicians. Our CEO is a family medic, a family physician, and we have a huge group of family physicians and doctors working on the iheed staff. So we're created by clinicians for clinicians. And Mark, your sound is working now. There, 1 minute. Wonderful. So just to let you know, we have over 400,000 course completions to date on our platform, and over 30,000 clinicians registered on iheed programs across the globe. So even if you don't recognize the name, we do have a very large global footprint, and we're a large, I suppose, well-renowned within the medical sphere and the medical community in terms of online education. And we do everything from short CPT right up to residency programs online. So just to talk a little bit more about the Royal College of Physicians of Ireland, some of you will be very familiar with them and some not so much. They're over 350 years old. They're one of the most prestigious postgraduate medical education organisations in the world. They're leaders in medical education. They specialise in postgraduate training, medical training. They're government advisors and thought leaders, and they established their Faculty of Paediatrics in 1982. And we have co-developed and accredited this program with them. So this means that iheed delivers the program, but the RCPI have full oversight and they give the qualification to you. So on your diploma certificate, it does not anywhere say that you are studying on distance or studying blended or studying online education. You will get the exact same qualification from the Royal College of Physicians as if you were there in person in a bricks and mortar environment. So you're at no disadvantage whatsoever to studying online, and you get the exact same qualification. So just to be very clear on one thing, this is a diploma in paediatrics. If you see here the UK General Medical Council, you'll see that they have the foundation, and then they have after year 2, they have their exams, and after year 3, they have their exams, and then the full specialty training in paediatrics takes 8 years. If you look at the equivalent in Ireland, the BST and the HST under the RCPI also takes 8 years, with an examination after BST, your basic specialist training, and an examination after your HST, which are higher specialist training to become a pediatrician. This particular program is RCPI Diploma in Paediatrics, which is 6 months in duration. So just to let you know, there's a huge variance between 8 years and 6 months. We are not here to make you a specialist in pediatrics. This is not the objective of this program. This program is to upskill family physicians in primary care, to reskill pediatricians, to, I suppose, give a very good overview to young doctors who are thinking of specializing in pediatrics. And we have a wonderful mix of some tertiary care clinicians as well, who just have a lot of presentations. As Amitava said, you can have up to 20% and above of children's presentations on your caseload on a daily basis. And, you know, I suppose the world of medicine changes all the time. So it really is very, very important to upskill. And that's what this program is. It's a simple 6 months diploma from a world recognized institution, the Royal College. It does not give specialist training. So I want to be very, very clear on that. So as I said, we're targeted for those working in primary care, early stages and specialist pediatric training, and then experienced practitioners looking for a refresh program. So that's what we aim it at. So the Royal College of Physicians of Ireland, just to reiterate, this is an academic qualification. There is no clinical oversight in this program, so it is theory-based. It's recognised worldwide. It's 44 CPD hours in Ireland, and that's the certification that they would get. And some regulators will grant standardised between 36 and 96 hours, depending on what jurisdiction you're with. But the Royal College has the AACME recognition and EACME recognition in Europe, and it has, I suppose, bilateral agreements across the globe because of its very prestigious reputation, that this diploma will be recognised for CME points globally. And as I said, just to reiterate the point, it does not confer specialist status. So I suppose the program objectives really is looking at the latest evidence and really helping you to upskill and just be very confident in common presentations in childhood cases and pediatric cases, acute care, screening, disability, development and growth. I want to just be very clear at this point that we don't really look at neonates and pediatrics and tertiary care. We do look at acute care and some elements, but mostly the neonates and tertiary care are not covered. Hospital-based care are not covered in this program because there's so much in pediatrics and you only have 6 months. We had to narrow it into a palatable and digestible amount of work for you. So you develop your knowledge and confidence in providing care with multidisciplinary teams. It's a stimulating online environment. Myself, I have worked in third level education for almost 2 decades, a long time, and I've had the unfortunate experience, unfortunately, of seeing very, very poor quality online education where it's just talking videos and downloadable PDFs with no interaction, I suppose, and no innovation whatsoever. This is I can confidently say that this program is in another league in terms of its quality, in terms of the online experience, its innovation. We have online quizzes, hot topics. We have a huge amount of touch points in the program, so you never feel isolated as a learner. You really don't. You feel part of a community, a collegiate group of 25 to 30 clinicians, and you will get to know that group very well. They often set up their own WhatsApp groups and discuss things individually amongst themselves. And there is a real strong interaction, because you have the live tutorials once a week, and I'll talk about them in more detail later, for 1 hour, and you have your discussion forums, and you just have so many touch points with your mentors and your classmates. And the online experience is so palatable and engaging that our NPS score, the NPS is a net promoter score. And what that really means in day-to-day language is, would you recommend this program to a friend or colleague? And that's in the 70s in our NPS score. And in most NPS scores, if you get above 20, is considered exceptional. To be in the 70s is, I have never experienced it, and I've been in education, as I said, for 20 years. And that is just a testament to our really talented tutors, our really talented academic affairs and team that look after you, and also our project managers, our instructional designers, our engineers that have put blood, sweat and tears into a program to make sure that your experience really is exceptional, and we can stand over it, and we're very proud of it. And we do encourage collaborative learning, promote the application of current scientific evidence. So I suppose I'll hand you over to Mark now, just to walk you through the content of the program. Mark, can you hear me?
Yes, thank you.
Wonderful, thanks Mark. If you want to walk through the program and what to expect in the content, that would be great.
So hello everyone, I'm Mark Rollins. I'm a consultant paediatrician. I've been a paediatrician for about 30 years and trained in London, Edinburgh, Dublin, Belfast and other parts of the world. So your tutors are all very experienced. We're all current lecturers at various universities, and also current examiners for Diploma of Child Health, for membership. So a lot of experience in teaching and how to get across paediatrics to everyone who deals with child health, not just primary care, secondary care, tertiary care, but this is really aimed to complement what you've learned either at undergraduate or even postgraduate. It's aimed for all interested in paediatrics. Some people worry, is this going to be too advanced? But not at all. We bring everybody on board, and the whole thing is to have up-to-date evidence base on paediatrics. And certainly we've been doing this for quite a while. We have a lot of information to transfer to various people, and it's a good fun course. And the good news is the pass rate is extremely high, and the ones who don't pass are the ones that don't engage. So don't worry on that score. And what I'm going to just chat to is just roughly what we do. It's as Rebecca's highlighted, it's a 6-month course online. We do 3 blocks. First block is just a simple 6-week block, and that's an induction, an introduction, and just going through typical teaching as you would for introducing paediatrics, up-to-date history taking, up-to-date general examination with examples. And then we'll go through about assessment of children, current assessment of children, either in the community, in hospital, in the emergency departments or tertiary care, and then going through the different scenarios. What you see is on each week is a tutorial which is run online with your tutor. So we're broken into groups of 20, 25. We get to know each other. I'm in our now 3rd block of our students, and we know everybody, and we have all sorts of WhatsApp and chat about lots of things. even up to date about COVID around the world and giving some advice on that. So first 6 weeks then, and then after the 6 weeks, we give you a week off to sort of prepare for what we say an exam, but it's not a written exam, it's online. And this is little vignettes, some multiple choice. And then we have a video submission, things like history taking or assessing, just providing a little video recording. We get you to get a surrogate or get you to talk into the computer, and we give you a scenario and you just send in a 5 to 7 minute recording, and then we assess that for you. And then we go on to a second block and a third block. There's a second block. Again, this is now 8 weeks. And you can just see we go through several topics. Each week, there is a discussion online to each group, which we ask you to comment on. So we give a case like a 7-year-old arrives in your surgery with recurrent abdominal pain, not getting any better. It's been investigated, but the parents are concerned there's still something wrong. How would you manage that? How would you manage children with headaches? How do you talk to parents with bad news about their family members and children, and all sorts of things. Again, we go through this same sort of exam setup, and then we have a third block then, and as you can see, we're going through functional disorders. Today I'm doing headaches and functional disorders in my group, and next week we're doing sort of recognition of chronic disorders and management and red flags, and then just going through all sorts of conditions. So we cover everything in that 22 weeks, and obviously we bring students along the line. So if they feel they're getting left behind, make sure everybody's brought on board. We're not training, as Rebecca said, to make you all consultant pediatricians. It's to give you a quality base, up-to-date pediatrics of what's happening out there. And at the end of it, you will receive a certificate of the Diploma of Child Health or Diploma of Paediatrics. There is a Diploma of Child Health in the UK through the Royal College of Paediatrics in London. This is equitable to it. You can put it beside your name, and it's approved by the Royal College of Paediatrics of Ireland, who have been doing a Diploma of Child Health. One of the problems with Diploma of Child Health is going to be difficult to engage and get formal exams done face-to-face with cases. And what we find we're able to do now is to do this online, so you can do it from your own PC, no matter where you are in the world. It's up to us to review our standards. The colleges review our standards, and they won't be letting us do this without maintaining standards. But we have had pediatricians who are qualified through their membership and have come back to do this just for an update for further exams. So it's actually can be at that level, as well as a level for those who've never dealt with pediatrics other than undergraduate in your medical career.
Wonderful. Thank you so much, Mark, and feel free to interject in any of the other slides as well. You know a lot more than I do. So as Mark said, it's a 22 weeks of content. We do break up the calendar based on your geographic location. So if you're a non-GCC group, you go straight through in the program. You'll have a break for Christmas and New Year, some small holidays. If you're in the GCC group, you will have a full break for Ramadan. So just to let you know that we do vary the calendar based on what part of the world that you're in. And when I say GCC, we often have participants from Pakistan and North Africa and that area as well. And you're very welcome, if capacity based and as subject to capability of us putting you in a particular calendar, to do which group you prefer. But in general, the GCC group will break for the Ramadan festival, for Ramadan and then for Eid, and then you'll come back into the program. We have discrete topics each week, and as we said, a 6-week block, 8-week block, and 8-week block. and you have an exam at the end. If you're not familiar with this online setting, many clinicians go, well, an online exam is not credible. How do you supervise and how do you maintain quality on this? Just to be very reassured that the Royal College of Physicians of Ireland do not give their brand and oversight lightly. We have online proctoring for our exams. You can do it in your own home at any location, but it is extremely robust. You are asked to pan your camera all over the room before you commence the examination. Your computer is locked, so we know if anybody else tries to remotely go into your computer. And you have one overseer, or I suppose person who's responsible for watching you for the duration of the entire exam. So if there's anything untoward, it's red flagged and we will investigate it later. So actually it is an extremely robust online proctoring system that we use, and it is reputable. It does stand up to the same, I suppose, quality as a face-to-face examination would. So as Mark said, we have the discussion post. So that's thrown out by the tutor every week, a topic or a case to discuss, and that will cover the topic that you are covering in your curriculum that week in your discussion forum, with links and suggested reading lists for that week. So there's no surprise that those who are most, I suppose, engaged in the discussion topic during the week are the ones that score highest in the diploma overall. So the more interaction and engagement you have with the program, the higher your grades are going to be. And we have then the online self-paced content. As I said, it is exceptionally engaging with wonderful videos and 3D videos, animations, hot topics, quizzes, and you easily, I suppose, just navigate your way through quite complex information in a very palatable format. So we're very proud of what we've achieved in the online environment. So it's a nice way for you to get through that content in an engaging manner. And then what all of our participants find the best is the weekly tutorial on a Zoom platform like this, except it's a lot, today we're very didactic and it's one direction. But during the actual tutorial, it'll be very discursive. You'll be talking to each other with your tutor, and your tutor is there as, I suppose, a compare or to guide you. And so it's not a lecture-based scenario. It's very much discussing a case-based scenario that covers the topic for that week with your fellow clinicians and peers and your tutor who moderates the tutorial. So it's a wonderful experience. And as a result, you get to know your fellow classmates very well, and the tutors always ask that all the cameras are on and you get to know each other's faces, you interact, you ask questions. So it is a very interactive, and you've loads of touch points on this program, so you're not left isolated. So as I said, the induction week is on the 25th of October. That's when it kicks off. And it's very important that you're there for induction week, because that really gets you acclimatized and used to the environment, what to expect, everything about the online experience, and getting you up and running. So it's very important that you're there for induction week. Engaging content, as I said, the weekly discussion forum that your tutor will put out, usually on a Monday morning, for you to participate in during the week with reading lists, and your tutorial online, your live tutorial. So that is the only synchronous or part of the program that you really must be there for that 1 hour per week. And that 1 hour varies depending on what part of the world you're in. So we structure the tutorials. So for example, in the GCC, it's usually on a Friday morning. In Malaysia and Australia, it's usually on a Thursday evening. On Ireland, it's a Wednesday evening. So depending on what part of the world you're in, we have the tutorial that suits the majority of the clinicians in that region. And just to let you know, we all know that you're very busy clinicians and you can have shift work. If you cannot make your live tutorial for whatever reason, they are recorded so you can watch it afterwards, but we do heavily and strongly advise that you do participate on the tutorial where possible. And there's the continuous assessments and the exams. So the exams are MCQs, they're online, and then we have small, I suppose, scenario-based questions as well that are small case vignettes covering a particular area and asking you how you would deal with that presentation. So that's what the exams are like. So as I said, it's a unique online environment. It's totally responsive, so you can look at it on your mobile phone, your laptop, your tablet, anywhere at any time. So if you are working shift work and you have a break and you've missed a tutorial, you can watch it then. So it's wonderful that you have that level of flexibility in your education. As I said, we deal very much in case-based scenarios, and it's imperative that all of our content is really related back to cases. So you'll see these children here, these pediatric cases, they're actually flip cards. So you can flip Rashmi over and it'll give you her presentation. So it's very interactive and it's all case-based. And then we have a focus on clinical decision making and management, as you see there. So there's an awful lot of photography and videos integrated with it to make it engaging. So as we said, so there's block 1, block 2, and block 3, which is 6 weeks, 8 weeks, and 8 weeks. So you have a skills portfolio, which is 10% and 10% in block 2 and block 3. And your exam weighting is 20%, 30%, and 30%. And the exam time is 40, 60, and 60. And as I said, it's predominantly MCQs with some scenario-based questions as well, and case vignettes. So what does this mean for you as a clinician on a day-to-day basis experiencing the program? Even though we have 150 students per intake across the globe on this program, you will not know that, because you are in a small group, a very intimate group of clinicians and peers of 25 to 30 maximum in your group, so that you will get to know them very well, and you'll get a lot of one-on-one attention, and you will feel looked after. You're definitely not a number, you're very much a name to us. It's in 3 blocks, as I said, well placed. We are very sensitive to religious holidays, and we do break in between for specific calendars in certain regions of the world. There's personal commitment. I know Amitava said 1 hour, but that is your 1 hour tutorial that you should be in the live tutorial. But we do say approximately 5 to 6 hours a week in terms of engaging in the discussion forums and looking at the reading material that we suggest. And when I say reading material, it's all online. We've very extensive access to the BMJ and formularies and excellent online library that you can access, and we have live links or hyperlinks embedded within our content that goes directly to that library, so you don't have to buy any books, textbooks, hard copies, nothing like that, and everything is included in the price of the program. And you get excellent support. You get to know your mentors exceptionally well as part of the iheed team. They'll be reaching out to you. And the beauty about online education is that it's analytics based. So essentially what we can do is we can look at you and see, okay, this person hasn't engaged, they haven't had any page views, they haven't been in a tutorial, and we can see analytically, okay, this clinician might be at risk of not performing well. So our mentors will reach out to you and ask, hi doctor, are you okay? We haven't seen you online in the last few weeks and you haven't been engaging. Is there anything we can do to help? And we totally understand in this new and very frightening world that we're living in the pandemic that there are extenuating circumstances, and we're very flexible to helping you to work through the program and to be successful on the program. So as I said, we have the support structure. So you have the program leader and you have wonderful tutors, just like Mark. You have the program team management, and then you have your technical support. They're the most unused people you can possibly imagine, the technical support, because the platform is exemplary and it works exceptionally well. But they are there. But the people you will have most interaction with is your tutors and your mentors, who look after you and guide you through the program to make sure attrition rates are low. So the program fees, eligibility first, it is only open to medical doctors with your MD or MBBS. So unfortunately, no, even though we're strong advocates of IPE, interprofessional education, and working in multidisciplinary teams, this program is for doctors only. Your English language is not required, so you don't need your IELTS, your TOEFL, your IBT, etc., or your Pearson. We expect a level of English, and when we're talking, our education advisors, when they're bringing you on the program, when they're talking to you in person, we will have an understanding of your linguistic capability. And almost all of the clinicians on our program were taught through the medium of English, and the standard of English is very high. So the Royal College are happy that the English IELTS is not required for this program. You will get, we will ask of you your university certificate formal identification, a photograph. It can't be like a selfie or something. It must be like a driver's license or national ID, and a personal statement as to why you want to come on this program. The price of the program is €2,500. There's a €500 deposit to secure your place, and you can either pay 2 installments of €1,000 or 4 installments of €500 for the program. There are absolutely no discounts or scholarships available on the program, just to let you know that. And I will say that we are stunned and astonished at the just the demand for this program. We have 3 intakes per annum, and this intake that's commencing at the end of October, on the 25th of October, is already 50% full. So just to let you know, if you are very interested in this program, the places are filling exceptionally fast. We had over 1,000 registrants for our webinars in the last 2 days for the paediatrics program. So just to reiterate, and I don't want to disappoint you, if you are interested, it's imperative that you apply fast and secure your place with a deposit. What we will be doing is essentially, after this, we'll be sending you an email with the recording of this webinar directly to your own email, and there'll be a link to apply and a link to pay your deposit. So the student experience, we have over 36 countries. As I said, it's hugely global and international. Participants from all over the world. I don't like the word students because you're all very senior working doctors, so it doesn't seem appropriate that you're called students anymore. So I prefer the term participants. From 36 countries, there's 92% student engagement with the platform and the learning environment. There's 100% positive feedback. That's from student surveys that we give out. And there's a 98% pass rate, and be assured that's just not because we're lenient markers. It's because of the dedication of the clinicians who are studying on this program, and they understand the value and they work hard. So it's that simple. As Mark said, if you get out what you put into this program, and our highest achievers and scorers are those who interact and engage with the platform on a regular basis. So just as a synopsis, it's a 22-week program with study breaks and religious breaks where necessary. It's open only to medical doctors. It doesn't cover neonates or elements of tertiary care. It looks at the common presentations in pediatric care. It's extremely innovative and online and enjoyable interactive experience. The diploma is awarded from the Royal College of Physicians of Ireland. Nowhere on your diploma does it say distance or online education, so you get the exact same certificate as a face-to-face qualification in the Royal College. It's €2,500 fee with no scholarships or reductions, and places are filling exceptionally fast, so I don't want to disappoint. So if you do want a place, this is the last intake of 2020, and the next one will not occur until spring of 2021. So we will send you out an email with all of the application links and the deposit link and the recording of this tutorial. So I will stop share there, and we will open to the floor for any questions. I'm sure there might be loads. So I don't know, Caoimhe, if you can unmute yourself if you don't mind, did you have a chance to look at any of the questions there? Or
yeah, there's quite a few questions coming in. I know a lot of people have questions, and I think you've covered a lot of it around price and if the program's online. Is this course helpful in getting a job?
Yeah, well, that's kind of similar to what we covered. Just to reiterate again, you do not become a specialist. You do not become a consultant pediatrician as a result of doing this program. But it does give you an enhanced improvement on your CV. If you're a GP, for example, and you're going for a partnership in a general practice, you are more likely to get that partnership than those who have not completed further education. And as Mark said, the Diploma in Child Health in the UK from the Royal College has been around for many years. And he has said himself, if he sees that on someone's CV, he knows that they're willing to upskill and they're enthusiastic and they're willing to work hard and enhance their education, and that speaks volumes on your own personal CV. So I think the career trajectory will not lead to a specialism, but it will enhance your CV, absolutely, because it is a very well recognised brand, the Royal College of Physicians of Ireland, and it is an exemplary diploma, and it's good to have for your own patient outcomes as well.
Yeah, yes.
Question there about
Sorry, Mark. Sorry,
yeah, sorry, Rebecca. Just support that. I work with a lot of doctors from all around the world, and I ask them what pediatric experience they have, and they will tell me they've worked here and everywhere. But I'm interested in what they have, what proof they have of studying and getting educated, as well as doing the clinical. And if I see a diploma of child health on their CV or beside their name, that tells me they've been prepared not only to work, but to be educated. So with the diploma of PEDS, if you want to put DIP PEDS beside your name, I know you've done an intensive, quality assured, up-to-date program in pediatrics, and you're interested, and you've kept up to date, and very important for jobs. We have had people who have gone into pediatrics with membership and have come back to this for an update, and so it covers the whole sort of breadth of pediatrics. Somebody had said, how can you learn about pediatrics in 6 months? That's not what we're about. What we're about is highlighting common issues, how to properly assess children, how to examine children, and how to manage common conditions that all of us come across when we deal with child health. So it is on a level with a diploma of child health. And again, you can do this online, and it is peer reviewed. This isn't just an online and a certificate that won't stand up. This will stand up because it's approved by a Royal College.
I don't know who Shoaib is, but he's answering questions on our behalf. We have regular participation from people in Pakistan, and the Royal College has equivalency recognition across the globe. So we have plenty of doctors already on the program from Pakistan, and they're doing exceptionally well. So it is recognized for I suppose, CME points and CPD points across the globe. Becky, you asked a question there on IELTS and TOEFL. It is not required for this program, so you don't have to have an English proficiency test to do it. So is it recognized in Egypt? It's the same really as the question on Pakistan. It is recognized across the globe as one of the Royal College diplomas for CME points. So that's what normally, and you will get the equivalent recognition in your own jurisdiction. I know the Royal College, RACGP in Australia, many of our participants have already submitted their self-assessment from this program to the RACGP and got equivalent CME points for the program. So I'm just looking at the questions are coming in thick and fast. As I said, it's €2,500, and you can pay that in either a 500 deposit and 2 installments, or equal installments of 500 per month over 4 months after your deposit.
Someone is asking, Rebecca, about will there be a program each year, and if we're unable to join this year, can we join the next batch in 2021?
Yes, there is actually an intake 3 times a year, in spring, summer and autumn, because of the very high demand for this program. So if you can't join in October, the next one will be in spring 2021. And it will be Aisha available in 2022 as well. So 3 times per annum. So you're very welcome to join at a later date if you're not able to join right now.
Is this diploma equivalent to the DCH, the RCPCH is also another question there.
Yeah, if I could come in there, it is equivalent to the Diploma of Child Health, but it is a diploma. It's a diploma of pediatrics as opposed to a DCH. But it's the same. It is the same. It's the same standard. It's probably more in depth because it's online and we can get a lot more across to you. One of the problems with examinations and face-to-face examinations, they can only examine in little parts, like the Diploma of Child Health in England, which I examine on, is some test stations and a few other face-to-face, but it's trying to get what this can do is we actually feel we're testing you and everything. to get the most out of it. I see a couple of questions there about, is this recognized for higher specialized training? Well, it's recognized as a high standard teaching program. It doesn't count for your higher specialist training. You'll still have to go through that in your various schools and colleges, but it is a recognized certificate which you will have and you can put at the end of your name.
Mark, would you mind, Rashid asked a question on what is the skills portfolio? Would you mind expanding on that?
Yeah, I mean, the skills portfolio is what we're trying to do. In the modules, there's a lot of information about different scenarios and courses and different areas. And then there's little skills in that we ask you questions, what would you do next? And then in the videos, we get you to explain what you would do, and we would analyze that and assess that and mark you on that and feed you back on that. So it's kind of maximizing what you can do online. Yes, we can never substitute face-to-face examination of patients, but this is near as good as, but also giving you a wide range and feedback on different skills that you learn.
Thank you, Mark. That's very helpful. Humera was saying, will it be written that it's 6 months in duration on the transcript? No, actually, Humera, it doesn't say that. All it says is the diploma in paediatrics from the Royal College of Physicians of Ireland. So it doesn't actually give the duration on the certificate. So there's more questions coming in on recognition. Just it is a diploma that you can get CME points and equivalency in your own jurisdiction for. And there is, I suppose, bilateral agreements with the Royal College of Physicians of Ireland with other colleges across the globe in terms of CME points.
Yeah. Just on the CME points, it's equitable and approved for 44 CME points if you complete the course. So it's a significant amount of educational points.
I think we've covered most of the questions there, everyone. Just to let you know that we have a team of education advisors, and they will reach out to you after this in next week, and they will be talking to you and thanking you for your participation and seeing if you want to progress on the program. And in the interim, over the weekend, you will receive the recording of this event and the application to apply and the application to secure your deposit if you want to progress with your application. So the team, either Mark or James or Owen or Anthony or Brian, will be reaching out to you in the coming days just to see if you'd like to progress with your application to the program. And it said, will it be mentioned on the transcript? It was an online program. No, nowhere does it say that it's distance or online. It has the exact same transcript as any other transcript in the Royal College.
I see, Rebecca, there's one question there. Is there any similar preparatory for MRCPI? That's the first part of membership in the College of Paediatrics in Ireland. No, there isn't. And there isn't similar to first part membership in the Royal College of Paediatrics in UK. So that's why this is quite unique. Now, whether they want to now copy us and do that, and it may happen with the current situation with COVID, but we've been doing this pre-COVID, and certainly it's going to be the way to go for future education. Our job is still to reproduce as best we can actual clinical situations and skills to help us treat children better.
Aisha, you have a question. Is it available after year 3 onwards? Does that year 3 in your undergraduate? If so, no. It's only for qualified MDs and MBBS. You have to have your bachelor completed. Perhaps you're actually a trainee in a residency program. If you are eligible. So you must have completed your undergraduate medical qualification to participate on the program.
Another question there, would it assist me being a GP if I came to Ireland? And of course it would. If I was on an interview panel, which I'm on various interview panels for paediatrics primary care, secondary care, tertiary care. And if I see a diploma of paediatrics, that means that you've been prepared to study and train and further your education. So it would be a bonus.
Yeah, Hamir, I think we've answered your question. You get the full transcript and it doesn't say online education on it. So you will get your transcript and it doesn't say online education. It doesn't say 6 months. Let me see anything else. Yes, the RACGP, we are in the process of getting RACGP recognition at the moment, but in the interim, the Australians who have been on the program, the doctors, they have done the RACGP self-assessment section to get the equivalency of their CME points recognised, and they have been successful in doing so. So while we're waiting for RACGP recognition, you can do the self-assessment part in the RACGP to get your CME points recognised. So I hope that makes sense. I think we're beginning to see a kind of repetition in some of the questions here. So I think that's the majority of the queries covered. So we will reach out to you by email with the link to application and deposit, and to see the recording again today if you're interested. So,
yeah, thank you for taking the time to see us, and we wish you well out there. Keep safe, and look forward hopefully to chatting to you in the future.
It's been a pleasure. Thank you so much to you all for participating, and we hope to see you soon. And as Mark said, please stay safe. Take care.